As women, we think that ordering hormones is easy or should be easy, but it's actually more complicated than that. So, what I'm going to do is discuss the various ways in which we can look at hormones and how to decide which way of testing is right for you, especially since there's multiple options. So I'm Dr. Lexi Lain. I've been in the field of naturopathic medicine. If you don't know what that is, we are trained as primary care physicians, and we really believe in a non-pharmaceutical approach when and where possible. So, root cause management in terms of your health and a whole person health. Anyway, I've been in the field for 15 years, and in that time, really understanding what women are going through, what types of labs are going to be appropriate or clinically necessary. And that's what I really want to give you a snapshot in with today, whether it's a blood test, maybe a saliva test, or even a urine test. Okay, so let's keep it simple. First of all, in women, you can do a blood test for hormones, but if you are a menstruating female, we want to know when you are in your cycle. So, if you're in the follicular phase, which is essentially the first part of your cycle, ovulation, or the last part of your cycle, luteal phase, you really need to know what day in the cycle you are in. Standard medicine, they're just going to run a blood test on you, and you're not going to have an idea on where you are in your cycle. And when you get those reference ranges on the side of the labs, it'll actually give you reference ranges based on follicular, ovulation, luteal phase, and menopause. So you must know where you are in your cycle. Okay, Dr. Lexi, well, what about when in my cycle is it best to run the test? And that does depend on what we are looking for. Just as a general consensus, it's 10 days after ovulation, give or take, or it's with this window between days 19 and 21. What we're looking for is post ovulation, where your progesterone is nice and high, as well as your estrogen. We're wanting to look for those peak parts of the estrogen progesterone specifically. We always want to look at testosterone as well, because young women or just women in general, we can be in testosterone dominance, which can put acne on the face. And so we want to see these pathways. It's not just about estrogen and progesterone, but also the testosterone. And there's another marker called sex hormone binding globulin. And that is another piece to the puzzle, that when we are being advocates for our own health and well-being, we want to be making sure that that marker is also being added. So, estrogen, progesterone, testosterone, free and total, and sex hormone binding globulin gives you a good enough version of, what is your hormones in between days 19 and 21 of a normal 28, 29 day cycle. Or if it's longer or shorter, then we start subtracting or adding days. But bottom line, know where you are. Now, that's like if you are looking at hormones just as kind of like a general consensus on, where are my levels? Now, when we start getting into you've had your period, but all of a sudden it's stopped, or you are late in development and you haven't started your period and you're approaching 20 years old or something like that, those are different scenarios. And usually for the woman who hasn't started her period at all, or there's a lot of erratic periods going on, one of those could be body weight, but we're getting into more of the causation, and I want to stay in the lab specifically. But for women who we're not sure, we want to be adding in the LH and the FSH, because we want to see what the pituitary, the brain, is doing, and how the brain is talking to ovaries, and are the ovaries listening, and if not, what's going on in that feedback loop. And depending on the complicated picture of a case, we might need to be adding in thyroid and maybe some other markers too. Okay, so that's a blood test, and you can absolutely do a blood test, no problem. And you can even do blood tests into menopause and all of that too. Perimenopause gets a little bit trickier because your hormones are changing all the time. So there's a population of providers who actually don't recommend measuring your hormones in perimenopause because it might look one way 1 month and it may look totally different the next month. I still like to test just to get a snapshot of what we're working with, but we really are navigating those waters, the perimenopausal waters. We're navigating those essentially based on symptoms and how you as a woman are feeling. And we're having to kind of navigate and choose a supplement care plan that's based on your presentation. And it may look one way 1 month and another way a different month. It's a little bit of a trickier dance. But even still, we could be doing a blood test for that as well. Okay, saliva. Usually we are going to do a saliva test when we are adding on an adrenal test. So the adrenals are spitting out cortisol, and that's what we're looking at. And cortisol is naturally high in the morning to tell you to wake up and perform, and then it starts to go down during the day. And as it's going down during the day, melatonin is going up. So you have this inverse relationship with melatonin and cortisol. So we want cortisol nice and high in the morning to say, wake up, and then to come down at the end of the day to say, hey, it's time for sleep. Okay, normally, well, not normally, a lot of times what happens is cortisol is not getting you up in the morning. In fact, it's much lower. And then what happens is you have cortisol high at night. That is a reverse curve of cortisol. But what we're wanting is a 4 documented measurement during a single day, at least. Now you can do 6 points and even 8 points, depending on, again, what we're looking at. And so what we are doing is we're actually either spitting in a tube or you can actually pee in a cup. So that's kind of nice, but we need to do it 4 times in that single day, 4 to 6 to 8. And what you can do with that is then add on hormones to that. So you do actually excrete hormones through your saliva, and blood versus saliva. It's fine to do your hormones through your saliva. I still would prefer the blood test, but sometimes when it comes to economics or time and convenience, you can absolutely do your hormones through the saliva too. Cortisol really is best done either through saliva or urine, so you can get that 4 spot. That's what you really need, or 6. And what we see with that is many times when you're not sleeping at night, that's cortisol that's elevated at night. And it's competing with melatonin, and it's probably because you're checking emails, you're watching social media, you're watching a sporting event, and you've gotten all of your excitement. That's certainly going to mess up our sleep patterns because it's spiking the cortisol. All right, so that's going to be blood, saliva, and urine. Now, let's go further than that. If you've heard of the Dutch test it is one of the commonly heard on social media tests that are out there. They're not the only ones who do this. I have a Meridian Valley Lab handout here. They've made this beautiful, beautiful chart that I want to zero in on. So it's really, really busy and it can be kind of confusing to look at. But why would we do a urine test where we are measuring metabolites? We want to look at this when we are concerned about PCOS, which is actually being renamed. Instead of it being polycystic ovarian syndrome, it's now polymetabolic endocrine disorder. It's a new acronym. They literally just rolled that out, I believe, in 2026. Anyway, but because it's a multifaceted metabolic endocrine issue. So, but PCOS, fibrocystic breast, if you're concerned about risk factors in hormone positive cancers, these are the sorts of things we might want to look at the breakdown of your hormones. So these tests are extremely helpful in understanding how does your body break down and metabolize these hormones. So if we were to kind of take this chart, let me just give you a for example. So the top of this chart is cholesterol. And then it goes pregnenolone. Now, what we're looking at here is really in the adrenal glands, right? So this whole chart is adrenals. And what's happening is this orange up here, that's going to be more your progesterone conversation. All the green is your cortisol and mineral electrolytes, blood pressure, that all that stuff. And then the blue is your testosterone. Purple is the estrogen. Being on camera, it's hard to point at these. Here's what I want you to know is all of these different markers, what they're looking at is how your liver is breaking down your hormones and how your liver is processing those. There's also a downstream marker on methylation. That's a separate video, methylation, but many of you may know the MTHFR gene mutation, which is just the inability it's the inability to activate your folic acid and then to then utilize your B12 for cellular replication and repair, hormone metabolism, and other things. So what we're looking at is essentially what is your liver doing? And so your liver has different rooms. This is how I've always loved to describe it is imagine three rooms in a factory. Room one, some things happen. And then in room two, some things happen. And then in room three, something happened, and you get to poop and pee out the breakdown. So we are peeing out the metabolites of your hormones, and we're able to see, are you making estrogens that are more carcinogenic? They're increasing your risk factors for problems down the road. Are you breaking your estrogens and testosterones down in a more inflammatory, problematic state or not? This becomes extremely helpful in understanding where maybe that estrogen dominance is happening, if we're giving you hormone replacement therapy, HRTs, if we are putting you on birth control and you're having a lot of problems. This test is extremely helpful to understand the bigger picture of your physiology. And when we can understand the different pathways and where your hormones are being broken down, and how they're being broken down, it can help us in targeting a care plan that is going to be more supportive to your physiology. So, the difference between a snapshot blood test and something like this complicated urine test is that the urine test is really looking at those detox pathways and looking at the breakdown of the hormones versus a blood test is looking at levels. So, hey, you want to know your hormone levels for pregnancy. You want to know your hormone levels for where am I in perimenopause? Where am I in menopause? Where am I with my HRTs? Are those working for me? That can be totally done on a blood test. It's way more cost effective and just good and fine. If you're wanting to add on adrenals, that's going to be your saliva or the urine 4 to 6 spot. And then if you want to dive in much deeper into your physiology, that is your Meridian Valley or Dutch test, either one. That is your metabolites. So I do all of those things. I am all online as a clinician with telehealth, meeting you where you are on the map. Happy to have a conversation. You can always schedule a free discovery call. Those are complimentary to you. It's a, hey, come meet me. Let's chat. Let's have a conversation about what you're looking for, how I can help, and we'll go from there. All right, I'm Dr. Lexi, and that is a quick and dirty on hormones and how to measure them. Dr. Lexi out.